I'm Jean. I'm a physiotherapist at Applecross Physiotherapy. But on top of that, I also coach and instruct group classes that are supervised by a physiotherapist, so that they're all low impact, but they're all also really specific to your condition or your pain points or what you want to improve off, whether it would be function or performance. So exercise is more what we call an active treatment. So in our toolkit of the ways that we can help people with pain, we've got your passive treatment. So that's all our hands-on therapy, massage, mobilizations or dry needling, which can help with pain and help with a reduction in pain. But at the end of the day, we're dealing with a weak muscle. It doesn't actually strengthen the muscle or change the quality of it. And that's where really we rely on more active treatments, which is where exercise comes in. So really what we'd be focusing on is increasing someone's capacity to take load or to tolerate certain types of movements and to make them stronger and to be able to do any movement that they want to, really, without any limitations. So we could even look at the really early on acute, like ankle sprains, and where its role would be used to help control inflammation or reduce swelling, restore range of movement or improve strength. Or on the other hand, we could also be looking at really chronic conditions such as your lower back pain. So we might be dealing with really stiff muscles or weak muscles or really poor movement patterns, and that's where really exercise would be one of the main management ways to help someone with their pain. One of the main conditions that I normally see in the clinic is people who suffer from lower back pain. So the cause of the back pain may be coming from different reasons, but usually it's from either a tight muscle, say in their back or in their glute, or even the back of their legs. And these muscles normally get tight because they're not used properly, or they're underused, or they're not strong enough to be able to withstand the load that the person gives it. So one of the ways that we can help move it is using equipment to help either assist the movements or resist it. So it can look in the forms of using reformer or using the cable machines or even using a trapeze table. So not only are we getting them strong, but we're getting them strong through a really big range of movement so that they're actually able to move freely throughout it. We get a lot of people like that, and they believe that just because you hit a certain age mark that all of a sudden your body is going to go downhill, and that's just not true. It's really listening to your body, but also understanding how to strengthen it and the right kind of exercises to help improve its function without working it so far outside of its capacity. And that's really where our group classes come in as well, because we can take the movements that they're struggling with it and really be specific and tailor it to their goals. So for example, I've got someone at the moment in my group class, two of them actually, who really want to focus on their golf swings. So that's super specific, but it's just their main focus. And so really what we have to look at is what the movement comes down to. We're talking about rotation and extension, but also the ability to be strong enough to move through those ranges really quickly as well. But on the other hand, you might be dealing with someone who just wants to be able to go into the garden for 2 hours a day and not have to pay for it later on with their back pain or their knee pain or whatever their problem area is. And so while we're working on strength with both types of people, their strength training can look really different, and their programs can also look very different as well. So when we talk about movement, we've got an available range of movement throughout our body, but if we don't actually use it or practice going to those ranges, then that's where you can get your stiff muscles or your tight muscles, and that can be a source of your pain. So really, it's to teach someone to be able to move throughout all their available range and to be able to get strong in them as well, so that their body is free to move wherever it needs to.